So special tests for the thoracic spine. Really, the special tests that I'm going to show you are going to be for trying to diagnose thoracic outlet syndrome. So that patient who has some paresthesias going out into their right upper extremity that you feel like and have already ruled out, like, you know what, I just don't think it's coming. I don't think it's a cervical spine radiculopathy, like something happening more proximally with a disc or facet joint arthropathy, okay? And this is something that has sort of drawn you to this area. They have tenderness over their pec minor area, perhaps palpating over this area, irritates or causes their symptoms in their arm. We're going to do something called Adson's test for thoracic outlet syndrome. So what I'm going to be monitoring, or let me refresh. For thoracic outlet syndrome, we're talking about compression of the brachial plexus, either between the scalenes or in that interscalene triangle, or perhaps between the clavicle and the first rib. So all of these tests that I'm going to show you are different attempts to either stretch that area and see if it has an effect on symptoms, nerve symptoms, or vascular symptoms in the upper extremity, because thoracic outlet syndrome can irritate or compress the brachial plexus, but it can also, or the subclavian artery. Okay, so we're going to monitor his radial pulse. Remember, his radial pulse is down here, just lateral to the extensor or the flexor carpi radialis. So I'm going to monitor his radial pulse. I'm going to put his head in a certain position. I'm going to want to see if this test position that I'm about to put him in reproduces his paresthesias in his upper extremity, or diminishes or obliterates his pulse that I'm feeling at the radial pulse at his wrist. Okay, so Ethan, I'm going to have you, when we're ready, you're going to take a deep breath and you're going to hold it, and then I'm going to have you tilt your, I'm going to just show him this ahead of time. Tilt your head back towards me and rotate towards me. Okay.
Like that?
Yeah. Okay. So basically, what we're doing, if we think about it, we're closing down that space between the anterior and the medial scalene to see if it compresses the brachial plexus and or the subclavian artery. Okay. And I'm going to hold it there for a bit of time, and I want to see if it reproduces the symptoms or has a change in his pulse that I'm monitoring. So when you're ready, you're going to take a deep breath in and hold it, and we're going to extend and rotate. And I'm asking, you can let your breath out, any symptoms in your arm? Nah, and I didn't feel any change in his pulse. But somebody who had irritation of the brachial plexus here at that interscalene triangle, or of the subclavian artery, that test might be positive. So that is Adson's test. And now for this one, I'm still going to monitor the radial pulse, but I'm going to have you squeeze your shoulder blades together and back and down and like puff your chest out. Okay? Okay, and so really what we're doing here is that we're reducing, you don't have to stay there, we're kind of closing down that space between the clavicle and the first rib to see if that reproduces paresthesias or obliterates his pulse. So now, yeah, obliterated. I know, but that's what all the textbooks say. I know obliterate is kind of a bizarre word. Okay, so I want you to squeeze your shoulder blades back and down and puff your chest out. Good. And I would be monitoring his pulse, which still feels fine. Any symptoms in your arm? No. Okay. For him, I know he doesn't have any issues, so I'm not going to stay there for any lengthy period of time. But in somebody who had symptoms, my guess is that their symptoms would come on usually by 20, 30 seconds. If not, then I'm done testing that one. That is the costoclavicular test in your slides, and I have these up just because I'm monitoring. I want to make sure I hit all of these. The next one is the Roos test. Okay. Yeah, so now you're looking at the picture. So you want your patient to be up here. I'm still monitoring his radial pulse, and they're supposed to be here and clench and unclench their hands for
Just
up to three, both of them, for up to 3 minutes. Okay? If,
slow and fast.
Right, so a positive test would be if the radial pulse diminished or obliterated. or if the patient can't hold their arms up here because they get weak and heavy, or they start, it starts reproducing the symptoms, okay? So I'd be setting a timer for 3 minutes. You can put that down. I can tell you that if I do this, like I start getting symptoms out in my ulnar distribution pretty quickly, and then my hands actually get kind of cold. So I've done this test on myself, and it is truly positive. Okay, so those are the tests for thoracic outlet. From another special test standpoint, I have talked about Maitland's CPAs and UPAs as being great provocation tests for the cervical spine to implicate regions of dysfunctions and to look at symptom provocation. The same thing would be true for CPAs in the thoracic spine and UPAs in the thoracic spine. So I'm not going to show you those because I just showed you some of those in the passive accessory testing. So you could use your thumbs over the transverse processes. That would be, actually that's not a Maitland UPA. The one where I talked about using your PA pressure over the facet joints, right? We used our thumbs over the transverse processes to create rotation. But you can do it over the facet joints, that area between the spinous process and the transverse process, to do traditional Maitland UPAs to look for symptom provocation. And then the one where we used our pisiforms in the mid to lower thoracic spine to do central PAs. Those are great provocation tests. Okay.